My name is Matt Dalton. I'm the chairman of SIA, which is the Stoma Industry Association of Australia, and I represent all the medical industry suppliers who supply stoma patients throughout Australia. Stoma is a Latin word. I actually studied Latin at school, and it means opening or hole. So rather than going to the bathroom normally, they replumb part of your intestine, and it actually comes out, the waste comes out the side of your stomach. And there is a plastic device which traps that waste, whether it be bowel or bladder waste, and it takes it away and disposes it appropriately. People normally have a stoma because of a number of reasons. Bowel cancer, colorectal cancer, bladder cancer, irritable bowel disease, Crohn's, ulcerative colitis, or even just simply road trauma. They need to replumb, so you don't go to the toilet normally, but you go on the side of your abdomen. OSTOMATES means I'm an ostomy patient. In other words, I carry a stoma bag. You would possibly be familiar with a word called colostomy. That's what it actually means. There are 50,000 patients in Australia that are currently wearing a bag or a colostomy bag, and there's about 8,500 new patients that come into the system every year. So if you do the maths on that, that's about 22, 23 patients that are operated every day. So Australia is a very modern technological society, but unfortunately, ostomy is not really an attractive cohort for the 50,000 patients in Australia. Their quality of life compared with other ostomy patients all around the globe is much, much lower. And that's because of a variety of reasons, right? The first would be, I'm always checking and worried about leakage. In other words, it getting on my shirt or soiling my shirt or odour or something similar. And that makes me very anxious. So that lowers my quality of life. A lot of mental health or depression sets in with patients. And these patients are not just over 50, 60-year-olds. These are kids, peds, adolescents, middle age. Cancer doesn't discriminate. But the quality of life in Australia is much lower than other countries, which is really poor. Mental health, depression. I don't want to normalise back in society. I have an impairment going into the workplace again, so I'll sometimes become a little bit reclusive by nature. Intimacy, about 60 to 65% of people suffer from intimacy issues after having an operation and carrying a stoma. So it's really unfortunate if you compare all the modern countries, Australia ranks lowest in terms of quality of life. We have currently, on a Stoma Appliance Scheme, a federally funded scheme, around about 4,000 ostomy appliances that are funded, which is great. But however, if you're in England or if you're in Canada, you've got about 9,000 products that are federally reimbursed. If you have more products, you've got more ways of being able to trap your waste. You'll have less skin irritations, and you'll be able to normalise yourself into the workplace or society much easier than what Australians are, unfortunately. Australia has a shortage of what's called these clinical stomal therapy nurses or stoma care nurses. There are about 430 to 440 that are registered in Australia, but if I look at other countries, there's 2 or 3 times more. So there's not enough clinicians that can treat appropriately, and they're the experts in the particular field. In terms of spend and GDP, England spends 3 times more GDP than Australia, and Canada as much as 5 times the GDP spend. So when it looks at spend per patient, Australia is really low of what they currently spend on each ostomy patient. There's been 5 reviews or attempted reviews of the Stoma Appliance Scheme in the last 30 years, and the action that's come out of them is nothing. So the reviews are done, if you ask me, for the sake of the review. There is, however, a 6th review which has just been completed by a company called Health Consult. And that was an extensive review on the eligibility and efficiency of the Stoma Appliance Scheme. And one of the key messages, there were a lot of small messages, but the largest message was that the Australian public get a raw deal. And the prices of the stoma products in Australia are much, much lower than any other European country. So unfortunately, they've identified that if you're an Aussie patient, you're actually getting a bum deal. Because of the nature of this disease, and if I can be frank, we're talking about who and we, it's not really a palatable discussion. And there are 50,000 patients that remain silent. They carry ostomy appliances and they don't want anyone to know. And unfortunately, when we look at patient groups and patient cohorts, these patients have been left miles behind. So our role is to actually educate and tell people that just because you have this particular disease, you can actually spend a completely normal life. And those 50,000 patients should be able to enjoy exactly the type of life that all of us currently enjoy. So it's all about ostomalife.com.au, and we're trying to educate the public and the politicians that this cohort shouldn't remain silent. This cohort should be able to have the rights of every other Australian. And if they improved and injected some funds into the Stoma Appliance Scheme, you might find the quality of life for Australian patients to automatically increase by 10 or 15%. This cohort really hasn't been looked after for the last 30 to 40 years. We have recently held a parliamentary event in Parliament House, Canberra, to educate the federal politicians on this particular Stoma Appliance Scheme and also this cohort of patients. And I think that's been really well received. And a lot of them were actually quite ignorant of the fact there's 50,000 Australians walking around with an ostomy appliance. Our role at SIA is to educate federal parliamentarians and politicians. And for the last 2.5 years, I think we've been able to ably do that. We've probably had 15 one-on-one discussions with senators and politicians, and without putting words in their mouth, they all unanimously agree that it's time now for 13 or 14 years of neglect to actually improve the patients' lives and those lives of all those people that have got bowel and bladder cancer, etc. So we've been talking to parliamentarians. Obviously, there's an election coming up. We do hope we've put in our third federal budget submission. We are hopefully this third time lucky. I do understand that the healthcare budget is under pressure, but just a small amount of money could make innovation and new technology zinging in this particular land.